Dr. Tim Nicholl here, Clinic Director at Maximize Chiropractic. Today I want to go over the effects of getting in an automobile accident, having whiplash, and not correctly treating or stabilizing your problem. In regards to auto accidents, these are the #1 cause of chronic degenerative problems, meaning that if you have an auto accident, most likely the problem won't be fixed and it will get worse as your age progresses. This is a 42-year-old female, and when we look at the side view of the neck, first thing you can see is the neck's completely straight, doesn't have that C-shaped curve. When the neck's completely straight, you'll see proper preservation of the disc until you get right here. When you look at this right here, what's happening is that this is spinal degeneration or arthritis, and this happens most commonly at C5, C6. Now, some would suspect that this is just common, but it's not common, it's just the normal mechanics of your spine. C5 and C6 are where flexion and extension occur. It's like whiplash, forwards and backwards. So the muscles and tissues that hold your bones together, those are damaged and injured during an auto accident. The problem is that it takes muscles and tissues time to heal. Some research will show 12 to 18 months for them to stabilize their actual functional regimen of movement. When you see arthritis very specifically localized to one joint, we can only assume that it's not age-related because all the other bones above it and below it are normal, but yet injury-related. When you maintain a condition like an auto accident, whiplash injury, and never correct the problem, this is what happens 20 or 30 years down the road. If you've been involved in an auto accident, the first thing you really want to do is to have a motion study of your neck, meaning that if you look at this x-ray, we need to have this person look down, have them look up to see mechanically how the bones are moving. Once you've had a motion study, then you want to undergo a phase of care that not only helps you feel better, helps you move better, but then you're also going to want that chiropractor to update images, take a post x-ray to make sure that there are changes in your movement pattern. If you don't correct the problem and you put a band-aid on it, you're going to deal with it in the future. And when you deal with it in the future, at times you may not be able to overcome the problem as if you would have years down the road. The biggest emphasis is any auto accident greater than 10 miles an hour. There is literature and research to support injuries to the neck. Get your neck checked. If you have been told things are fine from the emergency room doctor, that's great, but they're only looking for broken bones. At Maximize Chiropractic, we're really analyzing the effects of whiplash, and that's really why we like to call ourselves experts on auto accidents, because of the results that we get for people.